Welcome back. At 7:12, an enlarged prostate is a condition that most commonly affects men over 50, but it can begin once you reach your 30s. Men who suffer from an enlarged prostate or benign prostatic hyperplasia, BPH, now have a new robotic treatment option using the power of water. Dr. Stephen Carriere from Touro Urology joins us this morning to explain aquablation therapy. Good morning. How you doing?
Good. How are you?
Good. All right. Aquablation sounds, it's one of those words, it's kind of smashing stuff together. What is that?
So the aquablation surgery, it's a newer technology that, historically when you were treating people with enlarged prostates, you would have to choose between treatments that help preserve sexual function, potentially are more invasive with a larger prostate. The aquablation helps to kind of wrap that all into one, where it does use a AI-assisted technology along with water pressure, almost like a power sprayer. That helps us to avoid any kind of thermal energy that may damage tissue. And so it is able to treat the obstructing tissue, but at the same time preserve sexual function and other side effects that were a higher risk with some of those other traditional treatments.
Right. So I guess, what you'd run into in the past, people having to make a tough decision and then maybe even potentially living with the issue. Is that something that really is sustainable in the long run?
No, and I think that, with the newer technology on there, it's in the past you would have to have that discussion saying, hey, what are we prioritizing? Mm-hmm. I think now with the aquablation, it's something that it's kind of everything wrapped into one. It also is very versatile, that it can treat prostates as small as 30 grams or on the larger end about 150 grams, to where a lot of those smaller discussions are not necessary. A lot of those risks, you're able to say, hey, we've managed to kind of get the best of both worlds wrapped into one.
Okay, hey, that's definitely something that some people will love to hear. When if you're out there and you're thinking, hey, I might be in this boat, what's the best way to sort of approach the doctor to say, hey, maybe aquablation is something I'd like to do?
Yeah, so a lot of times patients will have seen their primary care doctor, have been started on some, medical therapies such as Flomax is probably the most common one. If they're not successful being on that, they can always get a referral to us, or if they're unsure, they can always, call our office. Referrals aren't always necessary on that end, to where, if you're unsure, there's no problem with asking or seeing us, just to say, hey, could I potentially benefit from this? Is this something that would help me in that regard?
So, we said at the top there that this is enlarged prostate, something that affects men over 50. We always talk about these different things, especially when you look at some of the different categories like mammograms, breast cancer, getting tested at a younger age. Seeing that, that it potentially could start in the 30s, is that something that men in their 30s and even into the 40s should begin to start thinking about getting, checking to see if that is an issue?
No, I'd say it's generally, you can have it at a young age. I'd say normally it's something that a lot of times men don't necessarily appreciate until they do, in the sense that it's a slow process building up to it, to where something you're seeing every day that, you may not appreciate how significant it is until you either start the medications or have something done. From the cancer aspect, that's something that we do recommend at around age 50 to start screening for, unless you have a family history. But the urinary symptoms don't necessarily have any correlation with cancer on that end of things.
Okay, all right. Well, it's incredibly interesting and great to hear that there are some new forms of treatment. So it sounds like something that some people will be excited to hear. Thanks for sharing that with us.
Yeah, absolutely. And if people have any questions or anything like that, over at Touro we do have it. They can always call the office and reach out. We're glad to see them.
Sounds good. All right. Thank you, doctor.